Hello, nephew community, and welcome to today's panel discussion. Today, we are joined by three nephrology experts to discuss how we advocate for patients with kidney disease and help promote kidney health. My name is Dr. Jill Green, and I'm a senior clinical and scientific liaison here at Otsuka, and I will be moderating today's discussion. The program is paid for by Otsuka Pharmaceutical Development and Commercialization, Inc. Speakers are either paid consultants or employees of OPDC. Before we get started, here are a few ground rules for engagement during today's panel discussion. The information provided is intended for your educational benefit only, and no CME credits are offered. It is not intended as, nor is it a substitute for medical care, advice, or professional diagnosis. Users seeking medical advice should consult with their physician or healthcare professional. While conducting this discussion, our speakers aim to provide you with information that is accurate, not misleading, and does not promote Otsuka products. You may notice that all attendees have been muted. This assures the highest quality of sound. We encourage you to submit any questions via the Q&A box at the bottom of your screen. You may submit questions at any time during the presentation. However, some questions may not be answered, or one of the panelists will follow up with you after the presentation has concluded. So in alignment with Kidney Month, the nephew community wanted to explore the prevalence of kidney disease in the United States and also explore how the entire kidney community can really rally around the month of March to raise awareness and advocate for change. Did you know that kidney disease affects approximately 37 million people in the US? And if left unaddressed, kidney disease may progress to kidney failure, where some type of renal replacement therapy, such as dialysis or transplant, is required for survival. The nephew community is fortunate to have three amazing leaders in the nephrology space join us today, and they will help aid in raising awareness about the critical need to recognize the risk factors of kidney disease and also empower patients to take an active role in their disease management. Our first panelist is Dr. Dahl. Dr. Neera Dahl received her MD and PhD from Tufts University School of Medicine. She went on to complete her internal medicine residency and nephrology fellowship training at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. After completing her training, Dr. Dahl established her impressive medical career at Yale School of Medicine, where she is currently an associate professor of medicine, medical director of nephrology, and the director of the Nephrology Clinical Trial Program. Dr. Dahl has been instrumental in developing the Yale Inherited Kidney Disease Clinical Program, and I would be remiss if I didn't mention Dr. Dahl's contributions to the polycystic kidney disease field. She has provided her expertise and guidance to the PKD Foundation for several years and currently is a member of the PKD Foundation's Scientific Advisory Board. Next up is Dr. Joshue Lipschutz. He completed his undergraduate studies, medical school, and residency at Indiana University. He then went on to complete his nephrology fellowship at the University of California, San Francisco. After his medical training, Dr. Lipschutz successfully established an internationally recognized independent research program that better explained the etiology of polycystic kidney disease at the University of Pennsylvania. In 2014, Dr. Lipschutz took a professor of medicine position at the Medical University of South Carolina, where he also currently serves as the director of the renal division and the Arthur Williams Chair in Nephrology. Dr. Lipschutz continues providing his invaluable expertise to the polycystic kidney disease field through his clinical practice as well as medical research at the Medical University of South Carolina. And finally, to round up our panelists is Dr. Thomas McCune. He received his medical degree and completed his internal medicine residency at Eastern Virginia Medical School. He then went on to complete his nephrology and transplant fellowship training at Vanderbilt University. Dr. McCune currently is a partner at Nephrology Associates of Tidewater in Norfolk, Virginia, where he commonly treats patients with complications due to diabetes, severe hypertension, and genetic kidney disorders such as PKD. Dr. McCune has a true passion for education and really is a leader in training those next generation of nephrologists. He is currently an associate professor at Eastern Virginia Medical School where he also serves as the chair of the Division of Nephrology, the Fellowship Program Director, and is the director of the Hereditary Kidney Disease Clinic. As mentioned previously, I will be the moderator for today's discussion. As the slide notes, not only am I proud to work for Otsuka, a true leader in the nephrology space who always is keeping the patient's interests at the center of what we do, but I am also a proud living kidney donor. I have been advocating in this space for many years, and although it can be tiring at times, change can happen. So without further ado, I would like to turn the program over to the real stars of today's panel discussion. Dr. Dahl, can you go ahead and kick us off?
It would be my pleasure. Jill, thank you for that lovely introduction. And thank you for reminding us about advocacy for kidney patients. We are going to start with just reviewing some slides looking at the prevalence and the causes of chronic kidney disease in the US. And what I thought I'd do is just start with the slide and then let our two experts kind of talk to us about what they see when they see these slides. So chronic kidney disease is very common. It's 15% of the population. In the US, that's 37 million people. And the vast majority of people do not know that they have chronic kidney disease. In the very early stages, it's really something that we pick up with subtle signs, with changes in laboratory tests, with subtle changes in blood pressure, in urine parameters, and it may go missed, particularly if it's not being checked. And so I feel in some ways that we're with kidney disease where we were with things like cardiac disease or high blood pressure, maybe 10 or 20 years ago, where we know the scope of the problem, but we haven't really thought about ways to try and address the problem in ways that start to impact the numbers that we're seeing. Dr. McCune, what do you think when you see this slide? What comes to your mind?
You know, what comes to my mind is the concern that people have that, you know, no one wants to end up on dialysis, and everybody wants to find a way to prevent their progression of kidney disease. And we, you know, right now we're in a time in which the number of drugs coming out to help slow the progression really is increasing greatly, and it gives me great hope for the future of the field.
Terrific.
Neera, maybe I was just gonna say,
yeah, please.
They used to call hypertension the silent killer. I think the same thing could be said for chronic kidney disease. 90% people just don't know they have it, and it's really important to do the screening with their family doctors. We do screenings at churches, we do them at public gatherings where you can be done with urinalysis or check blood pressure. So not only is hypertension the silent killer, but hypertension leads to kidney disease as well.
And thank you. Yeah, I think that's important. Certainly, I know those KEEP screenings, part of the National Kidney Foundation, right, have been very, very important to try and screen more people or people who may not have access to regular care. So that is critical, I think. Here, and sort of leading up to the causes of kidney disease, so the top two are the same as the top two for cardiac disease, diabetes and hypertension. And then there's a host of inflammatory conditions that we lump together, calling glomerulonephritis. And part of that can be specific. So lupus nephritis is a type of glomerulonephritis, and the same with IgA nephropathy. So different kinds of inflammation within the kidney. And then the most common genetic cause of kidney disease in affecting about 1 in 500 to 1 in 1,000 patients is ADPKD. And this is an autosomal dominant condition in which cysts develop throughout the life of the patient. And then over time, there is kidney failure and loss of kidney function. Josh, I'm going to start with you. How do you think we're doing in terms of getting at the root causes of kidney disease, and how are we doing in terms of making an impact?
Yeah, part of the problem is that there's an epidemic of diabetes and hypertension. We're seeing type 2 diabetes in kids now. So I think that we're going to be seeing a steady increase unfortunately in chronic kidney disease and end-stage renal disease. So I think we're doing better, but I think we're also having a lot more people, a lot higher incidence now than maybe we've seen in the past.
And Tom, what do you think about how we're doing, how the metrics are going from what you're seeing?
So we are indeed seeing increased number of patients with diabetes type 2 and hypertension. But one nice thing is that we have more targeted therapies for these diseases that can help protect both the heart and the kidneys. So I think we are moving in the right direction. It's a very hopeful time in my mind.
Yeah, I think that's exactly the case, right? We are seeing the numbers go up. But in almost every disease category, there are new therapies which weren't there just a few years ago. So maybe there's a light there at the end.